If we were going to make the argument early in the pandemic that we should stop in-person school learning because of a threat to children or maybe teachers, then that same argument would apply for children getting vaccinated.
Dr. Jonathan Bakhtari.
You can see it. I mean, it's crystal clear.
I think it's going to really revolutionize things.
Which is a big game changer.
Hi, welcome to another episode of Bakhtari MD. We all know by now that children and adolescents are disproportionately not impacted in terms of severity, disease, and mortality. However, it doesn't mean that children don't get sick. It doesn't mean children don't wind up in the hospital. And unfortunately, it doesn't mean some children don't die from it. Of course, the issue has always been that if there was a safe, effective vaccine with minimal or no downside, that it would be worth letting children have the vaccine to even prevent any illnesses and the rare hospitalization and death. So I think the bigger issue is the benefit versus safety, which is I think what most parents think about in deciding about a vaccine like this. Well, so we have to kind of look at this from a global perspective. First of all, what do we really know about the safety of the mRNA vaccine in general? In general, now that, over 180 million Americans have been fully vaccinated, we certainly have one of the world's largest clinical trial looking at this vaccine. And as I noted in previous videos, we're now at least, from December till now, a good 6, 7, 8 months in people getting the vaccine. And the good news is the overall side effect profile seems to be pretty good. Now we've used it now in children or adolescent, between the ages of 12 and 15 successfully. And there are no significant reports of serious side effects. So overall, the benefit may be tipping, or it has tipped, in favor of giving adolescent and maybe now children the vaccine. But let's look at what are the pros of getting adolescent and children vaccinated. We know that during this pandemic, schools have been shut down, activities for children like sporting events and other recreational activities have been impacted, and they continue to be impacted. Even within schools that are now in person, the strategy of what to do if someone's test positive, a student tests positive, or a teacher tests positive, the ongoing drama on some level continues. And as the pandemic continues and potential new variants come out, how is that going to impact in-school learning and the fallout for when in-school learning gets disrupted? We know now from many studies that the lack of in-school learning has had a negative mental health impact on children, has had an impact in terms of their social growth, and has even had an impact on weight gain in children because of staying home. So those are the things that directly impact the children and would be an argument for having children vaccinated if a vaccine that had a great safety profile would come out. Because one, we can potentially save the lives that would be lost, the hospitalization, and then we could also figure out a way to have children not have their school and activities disrupted as this pandemic continues and maybe even becomes endemic. Let's assume, for the sake of conversation, we can make the argument that this vaccine for children, the mRNA vaccine for children, are safe as it is in adults. I think then we just have to understand that there are many, many, many benefits to children, like I just outlined, that would help them in ways that we can't measure. Like I said, mental health, weight, and scholastic learning, and others. So the goal, if there was a safe vaccine, is to accomplish all that. Now, there's other community benefits to children being vaccinated, as we have talked about in the past, which is the community benefit would be their ability to integrate into activities of society without a lot of rigmarole, and the fact that as we vaccinate more people, we're going to get this pandemic under better control. And also in terms of children not being able to potentially pass this on to others who may be vulnerable is also an issue. So there's some community benefits, public health benefits potentially to having children vaccinated. There's some direct benefits to them. If we were going to make the argument early in the pandemic that we should stop in-person school learning because of a threat to children or maybe teachers, then that same argument would apply for children getting vaccinated. Because if we're going to disrupt in-person learning because we're concerned, then why wouldn't we want to give those same children a vaccine, especially if it had a great safety profile, so they could return? So for all the people who argued that children shouldn't be in school with a very good, safe vaccine, they should also argue for children getting the vaccination. There's a couple of things I want to go over in terms of vaccinating children and benefits versus side effects. I think the way to sort of view this in children is we mentioned the benefits that children could potentially have, and then we want to make sure that the side effect is so low that it warrants all those benefits. A couple of things that we need to think about is let's look at the vaccine, the COVID-19 mRNA vaccines in general. With over 180 million doses on some level, that's a huge clinical trial that has already occurred after the vaccine was released. And we have a really great sense for the very great, good side effect profile that it has. So if it pans out and it has the same side effect profile that we see in adults, which is pretty minimal, then all the benefits that we talked about earlier would then be worth it. And that's how I would view it. And if that's the case, this vaccine is relatively safe, then I think parents can start to look at this vaccine potentially as maybe just another childhood vaccine that children get. And it could be essentially in that same bucket, and it wouldn't be viewed differently. I think there's an inclination to maybe view it differently because the mRNA technology is new, but we've already, discussed that. And if the side effect profile is as it is in adults, a lot of that concern should be alleviated. The other thing I just want to kind of go over that I've talked about in my other videos, most vaccines, if they're going to have a side effect, they will have immediately or in the short to moderate term, but not long term. Again, that's the vast majority. And the reason for that is when you get a vaccine, it disappears relatively quickly, like the mRNA vaccine gets degraded within 48 hours. So the likelihood of having a side effect 5 years later is small, especially if there's been intense studies looking at it during the first 6 to 12 months. The likelihood that something will pop up 5 years later is theoretically possible, but we haven't really seen that much of it with the other 10 or 15 vaccines we routinely use in adults and children. So is it possible to have a long-term side effect from a vaccine that you only get 2 doses of and it kind of disappears? Yes, but that would sort of be like taking a medication, 2 doses of medication this year and 5 years later, having a side effect. I think when we think of long-term side effects in medicine, we generally think about things that you take long-term and then have long-term side effects. So in other words, let's say you take an ulcer medicine for 5 years and then get a side effect to it, because there are medications that as you take it have sort of like a cumulative effect, both in terms of how it helps you, but also in terms of how it will potentially generate a side effect. So if you take non-steroidals for 2 days versus a month or a year, the side effect profile is going to be much worse on something you take for a year. So I think to look at these vaccines and say, well, I'm going to get 2 doses, it's 3 weeks apart in this case, what's the likelihood that 5 years later, 3 years later, I'm going to have a side effect of that? And to that, I would say the risk is minimal to have a very long-term side effect. The other thing I want to bring up, which is the same argument that we put forward for adults, and I think it would apply to children, is I think just like we discussed in adults, almost everything in medicine has a theoretical potential side effect. And I think for the people who say, hey, I'm only going to take a COVID-19 vaccine if you prove to me with metaphysical certitude there's never any side effects, could never be any side effects. Well, that's not the same bar we use for other things in medicine. So in other words, when we have knee surgery, when we have our tonsils taken out, when we go to the doctor and get antibiotics or an ulcer medicine or blood pressure medicine, or we take our children in and have them, vaccinated for the routine vaccines that they currently get, or have children be treated with antibiotics. I think the bar for all those other things is not guarantee me no side effects and I will have all this stuff done. So I think you have to be really careful not to set the bar for the COVID-19 vaccine different than we set for other things. Thank you so much for watching. If you like the content that we're doing, please like and subscribe, and also leave comments below. We'll see you next time on another episode of Bakhtari MD.